Hello, thank you for joining us. We'll get started in just a few minutes. Hello, please tell us where you're joining from in the chat. We'll get started in just a few minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no relevant financial relationships. To receive a contact hour for this NCPD session, participants are required to attend the webinar and complete the evaluation form, which the link will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so the message makes it to us. Please use the Q&A feature for questions and the chat feature to interact with other participants. This webinar is proudly brought to you with funding from the Johnson & Johnson Foundation, with translation services from Japaigo. We'd like to thank our speakers for sharing their expertise with us today. Our speakers today are Barbara Stilwell and Emily McWhirter. Barbara has decades long of interest in public health and in supporting health worker performance through a range of education and practice initiatives. She has worked for the World Health Organization and for nonprofit organizations as a technical specialist in workforce development and education. She led the Global Nursing Now campaign from 2018 through the challenges of the pandemic until it ended in 2021. Emily is a senior healthcare practitioner with a PhD in nursing, a BSc Hons midwifery and strategic healthcare management education at Harvard Business School, USA. She has worked in the National Health Service in the UK and the independent and charity sector for over 35 years, 20 at a senior level across 4 London teaching hospitals, specialist centers, and general hospitals. Having been a director of nursing for 3.5 years, which included leading a hospital through the COVID-19 pandemic as the hospital director for infection prevention and control. Emily has since worked for the chief nurse at the World Health Organization in Geneva. We're so thankful to have both of you today, and we'll turn it over to you.
Well, thank you very much indeed for that great introduction and all the work that Sigma's doing. And it's really lovely to see so many people saying hello from everywhere in the world. And I think what's really heartening is that we're wanting to talk to you today about global nursing leadership. And I think it's really clear just from everybody saying hello and from where they're from that this is truly a global webinar. So that means that many of you will be up early in the morning, waking up in the middle of the night, and probably less of you sitting here in the middle of the day like I am in a very convenient time zone. So thank you so much for all of you that have made a big effort to come and listen to the work that Barbara and I would like to talk to you about today. So for the last couple of years, Barbara and I and other colleagues, Liz Madigan, who I'm sure many of you will know through Sigma, and Kasia Kabunowska, who's a public health professor at Maastricht University, got together to work on a really valuable, what we think is a really valuable and important piece of work. So delighted that Barbara and I can share that with you today. Just for the next hour, I'm going to give you a little bit of an overview around why we felt that leadership, global leadership in particular, was something that we really needed to focus on as a community of nurse professionals. So we're going to talk to you about why we put the work together. And then Barbara's going to talk in a little bit more detail about how we went about doing this to make this framework that we're going to explain to you and collaborative piece of work. And then when we've done that, we're going to give you some live examples and bring in another colleague who I will wait until the right moment to introduce to you. She will become as no surprise, but she's been a wonderful global leader in nursing and midwifery, and we're delighted that she will be able to join us, but a bit more about that later. Before we do commence, I would just like to say a very big thank you to Johnson & Johnson, who have supported us to do this work. It's been a really lovely project, and they've been very much beside us all the way, and we're very grateful for everything that they did to help us to bring these to you, the people who we hope will use them the most. So really to crack on with just talking a little bit about why now? Why is nursing leadership so important? Well, I'm sure that many of you know that well over 50% of the workforce in global health is made up of nurses. So wherever you see healthcare being delivered, you will see nurses. And we know that during the pandemic, the huge burden of responsibility to care for our communities fell upon nurses. And we know that in many countries and in many situations, nurses have paid a high price for the work that we all committed to doing there. I was running a hospital during that time in the UK, and I've been a nurse for about 36 years. And actually, I would say for sure it was probably one of the most stressful periods of my career. And I know that many of you will have shared all sorts of stories around what you did and how you managed to cope during the pandemic. And so for us, trying to learn the lessons as a global profession is really important now. Just in the UK is the inquiry into the government's handling of the pandemic. And I know many countries have had a deep analysis of how you learn lessons. And really trying to make sure that as a profession, we do that too. There were some amazing things that we did, but there were also some things that we can learn from. And so if ever we're in a situation like that again or similar, we may be able to take the lessons that will guide us then to something, to be able to deliver something in a different way. We also looked, before we got going with this, at the WHO's Global Strategic Directions for Nursing and Midwifery 2021 to 2025. And I'm sure that many of you are increasingly familiar with that document, which is really a roadmap in strengthening nursing around the world, nursing and midwifery. And one of its key pillars is around leadership. And it's really clear that whenever you learn lessons, whenever you're learning to do something new, wherever you're moving forward in the direction of a new strategy or decision-making, the leadership part of what you do is absolutely integral. We know that nurses since the pandemic, but perhaps even before, are feeling very disillusioned, tired, weary, burnt out, and undervalued. leadership is really important to galvanize a profession together, to face the challenges ahead of it, and to be able to move forward in a direction that people are happy to follow. So again, leadership is really important now. And then when we look at global nursing leadership and we look at where healthcare systems are being implemented, where decisions are being made about what sort of systems are needed, about what healthcare needs to look like going forward. If you look at who is making those decisions, it's not often that you will see nurses. You will see nurses because there are some wonderful nurse leaders, but you won't see them very often. You won't see them at tables where decisions are made. You may see them being consulted. You may be consulted yourself, but you may not necessarily see them in ministries of health, in government positions, running the World Health Organization, running big companies, organizations that deliver big health systems around artificial intelligence, around pharmaceuticals. Do you always see nurses involved in the decisions around how those companies operate? Not always. So it's really clear to us that to take our profession forward, leadership right now is really critical. But actually, when it comes down to it, none of us were really clear when we had some lovely discussions about this, about what actually is included when we talk about leadership. What is it that we actually need to know? What is it that we need to be able to do? And how do we know whether we can do it or not? So what are the competencies that we need to be able to say that we can be and will be the leaders that our profession needs? So that brought us into a need for a competency-based leadership training. And in many areas of nursing, competencies are no stranger to the work that we do, and following competencies in many of our technical skills is a critical, important thing in training. And as we develop into advanced nursing roles, the competency-based model, the frameworks that we use are really obvious to us in many cases, but not necessarily for leadership. And when we look back, and Barbara will talk a little bit about this a bit more, about the amount of documents and research we found was very little in terms of what has actually been written about what does competency in leadership for nurses actually look like. So we set around trying to create a framework that would be useful for nurses at all levels. So I'm going to hand over at this point to Barbara, who's going to talk through what we did, why we did it, and what we came up with in the end. So over to you for a bit, Barbara.
Thanks, Emily. And let me just add my thanks to Emily's, for all of you for joining us. I, like Emily, I'm in the UK, so it's a very great, very convenient moment for us, but I'm sure not for everybody. So really good to have so many of you with us. So as Emily said, we wanted to take an evidence-based approach. So a Sigma librarian reviewed for us against our parameters that we set, all the literature, and it was not just nursing, it was literature from the health arena. So we ended up with articles that were about leadership training for physicians, for other health folks, as well as nurses. Out of the articles that she found, 27 we deemed to be within the parameters that we wanted. So they had to be based on actual evaluation of a leadership program, rather than just what was a sort of point of view about leadership. And of those 27, when we reviewed them, we only found 10 that really were based on evidence and identified competencies. And that was the other really important element for us, that competencies had to be articulated. And it was surprising that many of the programs about leadership were actually, when they were written about, the writers said they were about leadership, which of course we knew they were about leadership, but we wanted something more detailed. We wanted them to dig down into how that was defined, how the evidence was used, and how they evaluated the programs. So out of all of those, out of those 10 articles, we identified these terms that you see down here, and you would expect them. I mean, leadership was in there, as you can see, mentioned many, many times, but for us, it was a rather general term, because what we felt was that leadership was the result of adding together all of the other competencies. So you'll see that we identified all the terms that we felt were particularly relevant for nursing. And I think it's important to say that we were looking at nursing, at the future of nursing and not the past. So we were looking at what sort of competencies will a nurse need to move into the next 50 years. So these are what we came up with, and we, having got all of those terms, we then clustered them, as you see. Next slide, please, Emily. And we cluster them into what we call domains and lenses. So the domains are the key areas that nurse leaders use for their work, that they are the competencies that we believe all nurse leaders, whatever level they're at, should be using. And the lenses are perspectives that you bring to those competencies. So, for example, you would want to bring the lens of diversity and inclusion to collaboration, for example, to communication, to management, strategic management. So some of the things that we identified were really applicable to all kinds of areas of work. And in a little while, we're going to give you some examples of that to make it clearer. Next slide, please, Emily. So here's the domains. Strategy, leading self and others. Now, this was very important to us because one of the things that we looked at very carefully was authentic leadership, and the other was compassionate leadership. And in order to look at those two types of leadership, you really have to be good at looking at yourself. So strategy and leading self became important, as well as leading others. Then collaboration and communication, transformation and change, and this is one of those that takes us into the future. You know, it's very tempting sometimes, isn't it, not to want to rock the boat. But as we look to the future, nurses are going to have to be the people that look at transformation and change. And Emily's already spoken about being involved in making decisions. Governance is critical for nurse leaders to be involved in, and not only involved in, but lead. And so governance, we spent quite a lot of time looking at the competencies. Evidence-based decision-making, I know you'll be very familiar with. Nursing has had this at its heart for, even when I was learning to be a nurse, which is many, many years ago, it was very important. And ethics, of course, what can I say, critical. And the lenses, we came up with diversity and inclusion, systems thinking. Now, this was new to nursing, but not necessarily to other areas of health, especially management. But systems thinking is about knowing that you're working as part of many systems that all interact and move together. And nurses traditionally haven't been taught this or learned to use it. We think it's very important. And of course, political savvy. It's critical, isn't it? If we're going to get into those decision-making arenas, we have to be political about how we work from the get-go, we would say. So we'll talk a bit now about the different levels of nursing and how we use these. Next slide, please, Emily. Oh, yes, I should say a word about what we did then. we identified 14 experts from around the world. So they were from every WHO region, and we asked them to look at all the domains and lenses we'd identified to tell us what was relevant, what wasn't relevant, and if we needed to reword the sort of overarching competencies that we developed. We then asked them each to identify another 6 people that would then look at the competencies as we developed them. And so eventually we had 49 raters that completed 2 rounds of this Delphi survey. And let me say again, they were from every WHO region. So we had real global buy-in, which is why we're so thrilled there's so many of you on this webinar from around the world. Next one, please, Emily. And then we, having done these Delphi phases, we refined the competencies. And what we're going to show you today, and what you can see on the website, is the results of this Delphi technique, getting raters to refine the competencies. And we would take them back each time, alter them, change them, and then rewrite them and put them out again. Next one, please, Emily. And this is what we came up with. Now, we hope you like this tree. It was quite clear that our pictorial representation was going to be something horticultural, because we had a flower to begin with. And then that developed, somebody made a suggestion that we had a garden, but we decided that was a bit too complex. And we ended up with a tree, and we really like the tree. This is on Sigma website, and it shows all of our domains and our lenses. Next one, please, Emily. And I'll take the next one because it's slightly repetitive otherwise. So what we then did was we looked at the levels of leadership, because some of the comments and questions were about, will all leaders do this, or will it be certain types or seniority? And we came up with 4 levels. The first is novice. And that's somebody who's learning to be a leader. So that could be a newly qualified nurse. They may not be in a leadership role, probably not. And they're just learning how leadership applies to them. But it's really important that they do. So it helps, knowing these competencies helps them to be reflective about their own leadership, but also helps their people they're working with, and goodness, we know this is important, to support the novice leaders to become competent. And, you know, we hear awful stories about how junior, novice, new nurses, student nurses are not supported. This is us saying we need to support our novices and recognize that they can be practicing leadership. The competent leader is the next level up, maybe a staff nurse on a ward, knows how to lead, leading a team, still a healthcare practitioner, and they may need some sort of, probably will need some sort of supervision in the sense of counseling, supportive supervision, helping them reflect on where they are, helping them get to the next level, which we identified as expert leader. The expert leader incorporates what's gone before, but is also a positive role model to other people. And they've got a high degree of expertise, they're experienced, they can teach leadership skills, and people respect them as a leader. So they're putting into practice on a regular basis all of these competencies, and they can see where they are in this framework, and they can see how to, as it were, as I saw somebody say yesterday, send the lift down to bring everybody else back up to where they are. So important. And finally, the luminary, and we had lots of discussion about this. We think this is somebody who sheds light on leadership, or a leading light, as it says here. But they're the people you know, and we all know some of them, and you think, wow, they are really good at this. They really know how to be a leader. They're the people that support you all the time. Don't lose their temper, don't get impatient, help you learn what you didn't know, help you see where to go with your role, with your next job, with your promotion, developing your skills. So that's how we conceptualize these 4 levels. And the next one, Emily, I think is an example. Is that right? Yeah. So what we'd like to do now is to introduce Pandora Hartman. Are you there, Pandora? Many of you will know Pandora. Hope she's managed to get on. Can't see. Can you see her, Emily?
Yeah, she's here.
Oh, she's here. Great. So Pandora is the chief nurse and midwife for Jhpiego, has a lifetime of experience and I believe is a luminary in leadership. So we're delighted that Pandora is able to join us, and we're going to just have a bit of a conversation about 3 of these competencies, which we've defined by level. So you can see this is on communication. So we say that the overarching competency communicates information about decisions, objectives, plans, outcomes, activities in a clear and transparent way. So everybody in the team knows what's expected from them to reach common goals. So the novice is probably not going to be talking to the whole organization, but will contribute to team feedback on a daily basis and should be getting feedback from the team leader about how they're contributing to the overall organizational goals, and so on through these. So Emily and Pandora, would you like to talk us through maybe an example that you can think of how this could be used at one of the levels? Maybe Emily.
Yeah, and I'm here. I think communication is something that perhaps as nurses and midwives generally we don't realize the importance of that in leadership, but it's something that nurses and midwives do from the very get-go, and I think you mentioned that, but I just want to say that again because thinking around this, I went back to my days as a student nurse, and if anybody had said, when were you a nurse leader, I don't think I would have ever said it was during my time as a student nurse or just after I qualified. And yet what I hope that people can see from this competency is that actually leadership when you're a novice nurse is really important. And what we've put in here as an example, and there will be many others that perhaps I hope people can identify with, is that your contribution in the way that you communicate is really important in leading people in your team, in your environment, when you're a junior nurse. And I was particularly reminded of a part when I was one of my first, I think it was probably almost my first week in a ward in a hospital in London. And we had to hand over our patients for the day. And I had written mine down because I couldn't really remember who the people were and what was wrong with them. And it was a bit intimidating and perhaps a bit frightening when you're just getting going and everything is new to you. So I'd written them down, and this nurse came up to me at the end. She said, "You're not allowed to write things down." And I remember thinking, goodness me, the things that I have to say are so important, and yet if I forget them, that really could risk something not being conveyed in the right way. But actually I've never forgotten that, because I thought, oh, goodness me, does it matter if you write it down or do you speak it without writing it down, as long as what you're saying is clear? And this is why for me this communication competency is really important, because it reminds me very much that novice nurses who are just getting going really have to have the skills to communicate, but do it already. So it's really being able to mark that part and say this matters, and to make sure that it's included. And as you grow in confidence, and even I remember then, by the end of my placement on that particular area, I didn't need a piece of paper because I got to know everything and it was better. But as a starting off point, I think it's really important to note communication is a really important part of leadership. So that was just my kind of take home from a very, very early days. It's a long time ago now, but it's one of those things that stayed with me forever, actually, around the importance of communication and getting the facts right and getting the information correct. And that never really stops. But I know Pandora's luminary role is around communication on a massive, big scale. I know you've got some fabulous examples and some insights into this. So looking forward to seeing what you're going to say.
Thanks so much, both of you, for this invitation. And I think one of the work on this particular set of competencies is an example of communication in itself. Just getting things out in multiple languages. Let's think about that. In our increasingly connected world, we can take this communication skill for granted, but different things translated, it can mean a different word in a different language. So we may think we're communicating the message, but are we really? So the inclusion of this is so important because it takes us back to basics. You know, with my English colleagues here on the line, I'm going to have to tease a little bit. The word for the midwives out there, liquor, Liquor. Right? So I remember when I was training on the American side, they would be talking about the liquor. What do you mean the liquor? Completely different, you know, amniotic liquor. Was she drinking? Was it fetal alcohol syndrome? Same words, different meaning, isn't it? So, you know, as we're moving through the pathway from novice to competent expert luminary, I love as well the correlation with the Patricia Benner model that takes us through the novice to expert, and we adding to it. And then we need to know that we're going to dance along the pathways as we look at communication. And then not just languages and multiple languages that we're interfacing with, but also communication, media communication, right? What's happening with media communication?
Yeah.
Social media, how we're communicating, #.. You know, so it's really, I think, pushing all of the generations into different levels of skills in communication that are now required to get out those key educational and organizational messages across the pathways of healthcare that's so important for all of it. So lots of fun to be had with this one, and lots of just step back and think again. I always think of that 3-second pause advice, like count to 3, restate. Did you really hear what we think we heard? And does it indeed communicate the same message?
Yeah, very good. Very good points there, Pandora. I just wanted to pick up one thing on the luminary. Presents complex information clearly within and outside the organization. And to reflect back that one of the challenges that we have as a profession quite often is presenting the complexity of nursing itself. And I think this reminds us how important it is to show how nursing contributes to organizational achievements, whatever they may be. And I know quite often we don't do that. We have our story, but we don't have the data. And I think this is also about presenting the complexity of data. So with that, Emily, what's the next one?
Yep, next one. And well, I think just before we go to, I just wanted to make one more point about the social media, because there's a question I've just seen in the chat written at the beginning about how our domains are aligned with the AONL competencies. And I think what I would just like to say is stuff around social media, which is something that we were really keen to address, partly coming out of the pandemic when so many people were subject to, I think, what we typically call fake news now, and the importance around communication and how we get our clear evidence-based messages out on social media when we're talking about healthcare issues. And I think this is where we wanted to be sure that these competencies were fit for the future. But in actual fact, things around social media and those things that we need to address are very much present issues for us that perhaps even 2 or 3 years ago were not such big issues. So where our competencies differ, I think, is in the fact that we've really tried to make them post-pandemic and current to what we need to know now, but also perhaps for the next 20, 30 years. And we have a program here where we will review these competencies periodically and make sure that they continue to develop This isn't a static document once in time. Here they are. We intend to keep making sure that these are refreshed frequently as the world changes. And I think global world in health is changing very quickly, and key in making sure that we are at those big decision-making tables is making sure that we keep up with those changes. So I won't bang on about that too much, but it was a particular thing of mine that we make sure that all the social media stuff, which is really complicated for us, we can really manage to address. So I'm going to, yes, go on to the next one. And the next example we wanted to bring to you was one around the strategy in leading self and others. And I think, Barbara, you made the point at the beginning about the fact that in order to be a good leader, you have to be really clear about how you manage your style. Look deeply into yourself and in the mirror to see how you come across. So you may want to just give a little bit more in depth about this, Barbara. I know this is a particularly important subject for you.
Yes, thanks, Emily. We wanted to try to convey through this that we are in a globally connected world, and post-pandemic, that is very clear, isn't it? The pandemic, as the name suggests, was a problem for all of us, no matter where we were. And I was running Nursing Now at that time. So we had over 700 groups in over 150 countries. And so I could see that the problems we were all facing were similar, if not the same. And getting the nursing voice to be heard during the pandemic, despite the fact that we were, on the front lines, really without nurses, nothing would have happened. We were doing everything. We were testing, we were treating, we were rehabilitating, every single thing, nurses were to be found there. But it was very hard to see nurses. So when we were talking about this competency, we thought what we need to do is when nurses become nurses, from the get-go, you see that you're a global citizen as well as a citizen of your own country. And what happens overseas affects all of us. So even as a novice, you can think about the way that being a global citizen is affecting your work, and realize that you too, as novice nurses did in the pandemic, can contribute to the global debate on what nurses are doing, where they are. We were so excited when we had a couple of novice nurses who were identified to take part in a global press conference with Dr. Tedros of WHO. It was wonderful, and they were fabulous. They were both novice nurses, but they were working on the front line and they could bring that perspective. So what we wanted to say was, never imagine for one moment that global experience is not relevant to you, wherever you are in your nursing career. So Pandora, you work now globally, don't you? And have done for a long time. Where do you see yourself in this? And what would you say to other nurses?
This is a very interesting one. When we look at the global citizenship aspect, I often say I'm global, global as a migrant nurse who was brought over in the last wave to the United States. I think it really shaped, even at a more novice level, that reality and the awareness of there are different realities just contained within one. And I think as a nurse and a nurse midwife, always looking at the ties that bind us as global citizens, we're all impacted by similar issues right now. If we look just professionally, education is the issue, service, leadership, as we're here talking about today, if we looked at the impacts of things such as climate change, right? What's happening in humanitarian crisis, it's that awareness, even though the crisis of conflict may not be in your backyard, well, that may lead to an influx, a difference in the refugee population coming, or nurses, if I turn, to Europe, just the nurse migration mobility aspect. So it's just that awareness to kind of rise above, which I know sometimes I get concerned about us as professionally as global citizens, because we're so often mired in the day-to-day kind of drudgery, too many patients, too much stuff, never enough time, that the ability to kind of rise above and see that total world concept can be quite challenging. So I'm going to throw the challenge back to everyone. So I know something practically that works is when you're having those days where it's all too much and they want more leadership. No, I don't have it in me. To realize that stepping backwards sometimes and seeing above actually then starts to connect us in a different way to what are some of the foundations that are going to be needed to move the profession forward. And it actually, conversely, looking at global citizenship can become a rejuvenator. And I look at things like the Facebook groups that we've got the global community of practice. There's lots happening with mobile social learning. I think all of these things in real time are making that even easier to see what's going on when I'm getting videos from real lifetime videos from countries on the ground of things that are happening. We're able to incorporate and pass those messages along. Case in point of this, I remember when I was working on my doctoral studies, and I did sort of a sub-analysis and realized that some of the particular counties within parts of the southeastern United States actually compared to, I remember Sri Lanka. Can you imagine, like, this was like right outside of Atlanta, but because of so much of the migration, so much of the poverty, I can think about cholera outbreaks and, some of the infectious diseases that are still in rural public health communities. So I say all this to say nothing is isolated. That's not somebody else's disease process or somebody else's problem with education. It's all of our problems as a collective nursing body. And we just got to keep pushing forward as we are ever more connected, which I think the pandemic showed us.
Yeah, absolutely, Pandora. Emily, anything to add to that one?
Well, I think one of the big drivers behind this competency, as you've already said, was the issues around global migration. And wherever you work these days, you look at the makeup of your team that day, and whether that's as a junior nurse in a hospital or in a global platform, your team is made up of nurses from everywhere. And therefore, in order to support staff to bring the best out of everybody, you do really have to understand what's going on everywhere. And I think one of the issues that we find these days is that people are very easily able to go to the source of information. So being able to navigate your way to find those sources and not rely on information being cascaded through different sources where it might get changed or it might get appear in a different way. Going to the source of evidence and information is something that we all need to be able to do. So knowing where you can get that information really is important as a global scale. So where are the information about vaccines in particular areas? Where is emergency? What is emergency care training like in one particular country? Because nurses from that country may be coming to work in your country. And it would be helpful to know what education they have had so that you can look at where perhaps you might tailor make a particular program. So understanding global issues is really, really important. And I agree. I think the pandemic for sure showed us the importance of that. And learning from each other is really important in this way. So we know that some countries' response to the pandemic was amazing and others were more challenging. And where can we learn from each other if we don't understand what's going on in the different countries from which we work? So I think this is a really, really important subject, and you could build an entire competency framework just around this. And I notice in the chat and in the Q&A, there's a lot of questions about how did you manage to decide what is in and what is not in. There is a point where I think, Barbara, you spent a weekend reviewing well over 250 different versions of competencies.
Exactly.
And sometimes you have to make a decision, but I think what we try to do is keep these really broad so that you can use them to the way that will benefit you the most, keeping in mind the philosophy behind each of them.
Yeah.
I think
this one is particularly good to look at through the lenses of diversity and inclusion, and also political savvy, and also systems thinking. Because, if you think about diversity and inclusion, we do have members of our team who have migrated from another country, but we have patients who have as well. Mm-hmm. And what do we know about them, where they've come from? What should we be talking with them about, helping them to talk about? How do we make them feel included? How do we make our team members feel included in what's happening?
Yeah.
And I just want to pop in with one quick thing on this part. As we talk about this leadership and communication and equity, it's even equity of information. Because as much as we talk about leaders leading others, the reality that information access is not the same across the board. So looking even in positionality of global leadership, being the source maybe to push some of that other information out to others. We take it for granted that people can access the research databases, but we know that's kind of almost the academic ivory tower to a lot of times have the access. And when we think about things like internet, so I think the impetuous then becomes in that global connected as well, both with communication and leadership, to see how are we reaching out to help our others in our global community to have access and bring in some of those equity pieces, which are not always thought about.
Yeah, good point, Pandora. And of course, it's taking a global mindset that led us to get this framework translated into so many languages, because we recognize, that English is not the only language. So it's important for all of those reasons. I just want to ask Linda, should we move on to some we've got 15 minutes left.
Yes, I think we could dive into some questions. There is a lot of activity in the Q&A and lots of interaction in the chat. So we want to thank you for that. If you do have any questions, please use the Q&A feature to ask your questions. There is a question in regards to the layout of the actual framework. And why did you put the lenses at the root of the picture and then the domains above that? Can you expound on that a little bit?
I can kick off with that, really. I see the lenses as I kind of have to visualize things. So I see them as a pair of glasses through which you see everything else. So if you're thinking of them as the roots of a tree, and so through each of those roots, you then grow everything from which everything grows. So it's trying to make sure that within each of the competencies, you look at it through the eyes of those different things. And as the tree grows, it will grow through the eyes of those different things. So I think that's why it's laid out in that way. I think it's really important that we do look at those issues when we're looking at competencies each time, and keep going back to those things. Am I reviewing this competency through the lens of, particularly for me, diversity, inclusion? What is it like to be a woman when I'm thinking of, I've just put up this third example here about being politically savvy and understanding the place of women in society in various different countries, because we all know that it isn't the same. So when you're looking at being a global citizen, or looking at supporting nurses who have migrated from different countries, being able to look at that issue through the lens of being a woman because of the diversity lens is a really important thing. So hence why, it's a roundabout way of saying, because they are the guiding directions, I think, for each of our competencies. Barbara, you may want to add to that, but I hope that helps a little bit.
Yes, I think you're absolutely right, Emily. I don't really have much to add to that, because I think you've got it. they are at the root of lots of things that we do, aren't they? That you have to bring the lens of diversity, inclusion, equity, all of those things into everything that you do, into your decision making. When you're looking at evidence, you have to look and see, well, how was the evidence generated? Which is something that people often don't do. There's evidence that this and this and this happens if you drink a pint of tea a day. Well, it only happens if you're a man aged between 50 and 60. So we need to be aware of how all of these lenses influence what we're looking at in other domains.
And then transitioning a bit, and thank you, Megan, for putting this on the screen. I know people wanted to see the visual again. Let's talk a little bit about communication. Do you think there's special communication training that's required for nurse leaders, or is this a common thread throughout the profession already?
Pandora, do you want to take that one or begin?
Absolutely. I think it's a common thread, but I think it's something that is in need of constant updating and refining as you grow in your career path. It's one thing to look at communication when it was communication at the bedside or in small family groups, and quite another thing when as you grow and I think of my most recent heart attack moment when you realize there could be a room of 2,000 people that you have to talk to. And so the shifting of your communications from the bedside to the different agendas and arenas and the ability to adapt to that. So communication is definitely not static. Particularly when we bring in the written communication from the academic to our standard SOAP notes, it's something we need to keep working on. And I don't think that we can ever say we are expert communicators, particularly in our multicultural world. There's going to be someone who may not understand or who you may accidentally offend if we're not giving exquisite attention to the nuances, even of things like body language and behavior. So we can never take anything for granted, I think, in any aspect of our profession. And we just have to keep on that mindset of constant development and constant growing, which is why I love this graphic of the roots of the tree that's always branching out into new things.
Thanks, Pandora.
With communication also, I think we have a world, and we're doing it now, is that we're communicating, through a small screen. And I think many times, consultations with patients are quite often done on a screen nowadays, that you sometimes, especially during the pandemic, you couldn't speak directly in a room with somebody. I had a situation once when somebody told me I'd had to deliver some very bad news to a family in an emergency department. And I saw them again about 3 months later. And she said, I remember how you walked into the room. And I knew when you walked into the room what you were going to say. And so it's not necessarily even verbal communication that we're talking about here. It's how you come across professionally, how you look, how you come across on a screen. It's a very different way of having to deliver news, to care for people, to provide healthcare services that we've ever had to think about before. So thinking about all of those modern ways we communicate as part of this is a really important part, actually.
I think that's really what you've both said. I really resonate with that, and I think also there's another area that nurses need to become more confident at, and that's public speaking. And it can be utterly terrifying. For some people, they just really don't want to do it. And we all have known senior nurses in our careers who've sat silently in meetings where they really shouldn't have sat silently. But we need to help them. We need to say, how can we help you to feel confident to speak in a large meeting, which is mostly men sometimes, isn't it, too? And sometimes women feel very intimidated by having to speak. So how can we help people do that? And the question was, do we need teaching communication? Oh my goodness, yes, we do. I think we all need teaching. And as Emily says, it's something that changes throughout our career, what we're going to, who we're speaking to, how we're speaking, what we need to convey. And I think it would be brilliant to have some, problem-based learning around communication throughout our careers. That's my personal opinion. It's but nevertheless, I'm putting it out there.
You're not alone in thinking that, Barbara, for sure. I think we say a lot, if there isn't a seat at the table, bring your chair. But I think you could add on to that. If there isn't a seat at the table, if you have a seat at the table, make sure you have something to say.
Exactly.
And I think, we've all been in rooms, as you say, when people haven't spoken up, and it isn't necessarily because they don't know what to say. It's because they don't know how to say it, and they don't know how to break into a conversation, or they don't know how to make a point across. Practicing your elevator pitch actually is a really top way of concentrating what you want to say in 3 sentences or in 20 seconds or however long. And I think you can practice that, practice in these sorts of things. It not only gives you the tools to do better, but it gives you the confidence to be able to do that. And it's each time, even when you do a webinar, I'm always nervous when I speak in public, no matter whether I've done it once or 100 times. And yet I always think, right, get yourself your first line. And once you've got your first line, you're probably going to take off after that. And then everyone will tell you to be quiet. But it is about training and practice. I will be quiet in a minute.
Absolutely. I always say every aspiring nurse leader could do with taking an improv course. Throwing yourself completely into a new environment altogether to get some of that. And what you're saying, Emily, is segueing a lot into that domain of political savvy, because knowing how to, and I do a lot with policy dialogue, how to shift that speech, based upon the realities and what is happening in that particular moment. I know there's a hot debate about whether nursing and midwifery is political and or not, but really it is. And I think it has always been political and shaped by gender. Even when we look at some of our amazing historical figures, when Clara Barton, who some of you may know, she was Red Cross. She opened the American branch of the Red Cross. After she was invited from Switzerland to open up another branch. And, we're all familiar with the Red Cross and the International Red Cross. Well, she had to go and then talk to the president. Can you imagine? To sort of make the advocacy claim in a time where women just did not do that. Well, clearly her elevator pitch went okay, but not necessarily the first time, if you believe some of the historical accounts. But that's not a space she ever imagined. She was just trying to set out, to capitalize and do some more good work, right? And give nursing care to those who need it. But she wound up in the presidential office. So it's things like that, I think, where we can never quite imagine where the career is going to take us. But that political savvy, that degree even of activism, when we look at some of the foremothers in getting some of the schools of nursing and midwifery open and getting things professionalized. Another great example, when we look at the lifetime of Mary Mahoney, one of the first nurses of color to get professionalized and get things done. There's lessons. It wasn't just about good clinical care at the bedside. It was bringing all these other speaking and presentation into the look and the feel and the reality of the world of nursing and midwifery.
Thank you, Pandora. Great reminders. Linda, I think we're about out of time, are we?
We are almost out of time. I want to just say we did not get to all of the questions. So how would you like participants to connect with you all after the webinar?
What are the options?
Well, you've got Margie's email is one of our last slides.
Oh, yes.
So perhaps Margie could coordinate I know she's listening behind her screen there. Might be able to coordinate, and then we might be able to respond to people.
Happy to.
Through Margie, if that would be.
Thanks, Margie.
Wonderful.
Yes, we're happy to respond to anybody and everybody. So just
Absolutely.
give us a buzz. Yeah.
Megan, could you advance a few slides, please, to the thank you slide? There you go. Perfect. So we want to thank our speakers and thank you to Pandora as well for joining us. And we are so thankful that Johnson & Johnson provided funding for this and that Japigo provided translation services. As a reminder, this webinar is recorded and will be available on the Sigma repository within a few business days of recording. We want to thank you for attending, and we hope you have a wonderful day.
Thanks very much. Bye-bye.